Dokbo is one of the nearby villages where pregnant women from Dover give birth. It is about 30 minutes walk or 5 minutes drive away from Dover. Though the road is tarred, the availability of transport on that stretch is rare. 10 minutes into our trek to Dokbo, we came across this bushy, uncompleted project. The community leaders tell me this is supposed to be the self-help hospital project for the people of Dover. It's been over 10 years and the people are still waiting for support to complete this hospital facility for use. Kwame Chidiche is an elder in the chief's palace.
We also vote in Dover. So the government must be interested in our welfare when we cry for help. The hospital was constructed by the townspeople themselves, but whenever we call for help at the stage we've reached, nobody seems to care. They just come and leave and we never hear from them.
When completed, pregnant women from Dover and other surrounding communities are expected to deliver here. But as it stands, elders in charge of this project are unable to tell when this hospital is likely to be completed and equipped for full use. Until that time, people like Mansa will be moving from one village to the other in search of a traditional birth attendant to help them deliver their babies. Azato Anyimonu is one of the traditional birth attendants who assist pregnant women from Dover to deliver their babies. She does this with the assistance of her elder brother, who was absent at the time of our visit. Azato is unable to tell us her exact age, but she believes she's well over 50 years. She's been assisting women in labor for over 20 years. She proudly and confidently tells me she's never lost a child in her occupation as a traditional birth attendant. Lack of space, delivery items and equipment, as well as poor support from health officials in the district is causing Azato to lose interest in the job.
We don't have delivery items, we don't have beds, we don't have gloves, we don't have cotton, even antiseptics like Dettol, we don't have. There are some women who report with their delivery items, but others come empty-handed because they can't afford, so you are compelled to use your personal items to help them deliver.
Currently, she delivers pregnant women of their babies in an apartment belonging to her brother, who is a staff of a quality grains company.
They haven't built any apartment for us. I used to receive and deliver them in my personal room. But since I started having many more children, there was no more room to accommodate them. So my brother gave me a room after he was allocated an apartment from his company. That is where I deliver the pregnant women now.
Azato rarely gets paid for her services. This is because her clients are unable to afford any fee. Others never return to pay for her services, even after she considers them.
Sometimes I charge 50 Ghana cedis, but even that, it is not everybody who is able to pay. Others pay half. There are times when the delivery is complicated, and by God's grace, it is successful. We talk to them, and they later return to pay everything. There are those that you will just have to consider because they will say their husbands are not available, and so they will pay half of the amount, promising to settle the rest later. Some do, but others never return.
How is she able to refill the delivery box when the items run out?
You see, often I plan in a way such that I buy the items in bulk. When I use a portion of it, I try and replace them before they run out. So currently, I still have some thread and cotton wool at home. I can go and show them to you.
She takes me to her house to show me the items left in her box. In her little wooden box are old and worn-out rubber gloves, which are discolored, an indication they've been kept here for too long. She also showed me a shoe brush for cleaning. She showed me a blue plastic bottle containing spirit and another dark brown bottle supposed to be containing her antiseptic for dressing sore and the umbilical cord. An old roll of cotton is also among the items, but this gives me cause to worry. This woman clearly has a good heart in helping to save the lives of mothers and babies, but obviously not with these items. She said she had to give up her kinky business to attend to the women in labor. That is the level of her commitment to this occupation.
Chachala mofo kokwe kaka mava kpobe evijiji pri kokwe domai manyo yekuma varas le kokwe nti.
Initially, I cooked kinky for sale, but I noticed that handling kinky and childbirth at the same time was not good, so I stopped the kinky business. The reason is that imagine handling blood and later mixing dough for kinky. Health-wise, it really wasn't the best. There will be times while in the process of preparing the kinky dough, then an expectant mother will come to you in the evening to ask for your help to deliver. I have to leave what I'm doing and attend to her. Often, labor may delay, and by the time you return, the dough is spoiled, and you have to throw everything away. Then it becomes cost to you. So I stopped. I now go to farm. Even that, they often come to call me from the farm to attend to expectant mothers.
The question, however, is who is watching and supervising her activities for the good health of mothers and babies she saves through childbirth?
They themselves know the nature of the job we all do. They have the items, but they won't give them to us. Meanwhile, they have trained us here in the village to be helping them, but they are unable to help us as they should. We have to use our personal items to deliver the expectant mothers, and they don't give us anything. As for us, we're only saving the babies for the sake of God. But if the government later realizes that we are working with them and they decide to assist us, we'll accept it.
Dr. Joseph Nweti said the Ghana Health Service has stopped training TBAs. He explained beyond helping the women to push their babies, the TBAs lack the skill to handle complications that may arise and can only be best managed at the hospitals.
You know, some 20 years ago, we were training TBAs to be able to identify danger signs and then to refer them appropriately. But now, new knowledge have come, which indicates that obstetric emergency cannot be predicted. Secondly, when those complications do occur, there is nothing the TBA can do about those emergencies. One, if a woman delivers and starts bleeding, what we call postpartum hemorrhage, there's nothing the TBA can do about the bleeding. Secondly, if a pregnant woman or a woman who has just delivered develops eclampsia, there's nothing the pregnant woman can do because they cannot handle such emergencies in that area. Again, if a pregnant woman gets delayed second stage, delayed second stage is one of the indications for cesarean section, emergency cesarean section. Obviously, the TBA cannot do cesarean sections. And so, where the key major obstetric complications that can confront a pregnant woman who delivers or who is about to deliver, the TBA cannot do anything about them. Because of this, we don't think it's prudent to continue to train them.
Aloy is another village where women from Dover go to deliver their babies. Mama Anthony is the TBA in this village. She shows me a very small room belonging to her brother, which serves as a delivery room. She tells me, since there's no bed, they lay racks on the floor for the expectant mothers to lie on for delivery. After delivery, she manages the nursing mothers for at least 3 days. She's however worried the condition under which she does this is appalling.
Me vai para bridge. Aso me o peg mama le me su. Eta akai boy me la apple. Akpelenti na me givevo. Nya ko bla ho.
We buy blade. We don't have the peg, so we buy black thread to cut and tie the navel. No gloves. We don't have proper bed, and we only lay rags on the bare floor. Though we know it is not healthy, we do not have any option. At the moment, we are managing, but we can't be sure about tomorrow.
Mama Anthony tells me the lack of these items affect her work and therefore needs support.
We need a delivery room and delivery items to save the women. There are those who don't even pay for our services. I, for instance, charge as low as 20 Ghana cedis or ask for a cake of geisha soup, but we may not even get it all. All of these are cost to us, so we need help.
So what options do these women have as they continue to deliver pregnant women without any professional assistance? And what is their motivation? Dr. Nwete provides some answers.
Now what we are trying to do is to dialogue with them, is to have close relationship with them, is to develop a very good relationship to them to the extent that they will rather refer their cases to the maternity homes that are available either at the district level or at the community level. Now, we found out that in their scheme of things, in their operations, people, they don't even get paid. People don't even pay them for the services that they render to the people. So the argument is, if they render services and the people don't pay them, why would they continue to do it? So we have come out with a strategy that instead of them staying in the villages and doing the work, and when they develop challenges they cannot handle it and create problems for the sector, we will rather encourage them to bring their cases to us, and then we motivate them. So in other areas, what people have done, when the TBA brings a pregnant woman, they give her a bar of soap or a gallon of parasol, or some baby items or cake soaps which she can use on her own. And I think that is, for them, it's more rewarding than to continue to do deliveries where the people will not even pay them anyway.
Reducing maternal mortality is key among the Millennium Development Goals. Ghana's efforts towards achieving this MDG 5 hasn't been the best over the years, though general records have shown a level of progress. In the Volta region, for instance, a total of 63 women died while giving birth in 2015. The number shot up to 71 mothers dying in 2016. This is just the case of 2 hospitals in the region. The disturbing situation, according to the Regional Health Directorate, negates their efforts at reducing maternal mortality.
2015, we lost 63 women. 2016, we lost 71. For me, my heart aches when we lose any woman, because I keep saying that pregnancy is something that happens as a result of something that happens between a man and a woman. And if the man implanting says the seed does not die, why should the woman who is taking care of the seed die when the time comes for her to give account of whatever she's taking care of? And so we do our best to prevent that. All that we've been doing, because we know if we have enough midwives, we'll be able to reduce the numbers of the women who die during delivery.
Here is a community where pregnant women cannot give birth. The heavily pregnant women in excruciating labor pains are saddled with the burden of securing transport, which is rarely available. Then, when she manages to find one, she has another hurdle of securing a traditional bed attendant. This TBA, who serves as the bridge between the community and the hospital, is not properly equipped and resourced. Health professionals in the region are not oblivious of the challenge. The effort, however, in averting the obvious is hindered because of this tradition. Dr. Nwete laments their difficulty as health workers in that particular district.
It's a big challenge for us as in health, because of this, we are not able to put a midwife in the community. Because our plan is that wherever there is a CHIPS compound, and you just saw the new CHIPS compounds, we want all the new CHIPS compounds to have a maternity unit. And so if we want to put up a CHIPS compound in that community, because of this tradition, we cannot add the maternity unit. And if even we added the maternity unit, they will not allow us to bring a midwife, which is not the best. So it negates all the efforts we are making to reduce maternal mortality and, for that matter, improve maternal health care in all communities in Ghana.
Alloy is also the rearing cottage for Dover. All their livestock, talk about cattle, sheep, goats, pigs, and the like, including domestic birds, are kept and raised here. None of these must travel or cross boundaries to Dover. It is only when they've been slaughtered and dressed for feeding before they can be moved to Dover. Interestingly though, dogs and cats are allowed on Dover land. I asked why. Kwame Chidiche explains.
Lenya lanyele duobi. Mi duolade. Kemi legie, mi duola. Na kujole mieji. Mi plan la va wole duom.
We eat meat in Dover. During funerals and other festivals, we kill and eat meat, but a dog is more of a security pet. It protects us humans. That is why our forefathers did not include it in the taboo.
Like this, me talk bu mo kwede ekomo. Mo kwede komo. Eta wo la onya bia mo mu jola onene. Eta wo le mi dome le duome.
Despite living and knowing the taboos so well and adjusting to them, for people like Patience, taboos that prevent women from delivering in an environment they are fond of is inimical to civilization and development. She therefore prays for its abolishment.
It is my prayer that my people will come to know God and receive Christ, so that our troubles as mothers will be lessened.
The Regional Health Directorate once attempted responding to prayers such as Patience. They were, however, unsuccessful as they were faced with stiff opposition from traditional authorities.
My plan was to go there further, to have an interaction with the whole community, and then as a community neighbor, and then see how best we can solve that problem. Unfortunately for me, I was invited to give a talk at the regional House of Chiefs here in Ho, and this issue came up, and the journalist picked it. And the maternal mortality channel, this series they were doing for maternal mortality, they also picked the story, and they invited the chief. So we happened to have met at the studio without my knowledge. And the chief didn't take it kindly with me. His beef was that, why did I talk to the press about if I had any problem, I should have come to him to seek clarification. But I told him it was not my intention to talk to the press. The issue is that the press picked the news, and then I granted the interview.
For now, Joy News Hotline is unable to independently confirm any deaths of babies and mothers from this community as a result of this taboo. But is it inevitable? Perhaps until that time, custodians of practices as pertains in Dover begin to appreciate effects of their actions and inactions on their subjects, pregnant women in Dover and others who have not been mentioned in this piece but are enduring similar situations elsewhere will continue to bear the brunt of these practices while hoping for a new dawn. My name is Amofa Ewenam Atiamwa Eli. Joy News Hotline, Mafi Dover, Volta Region.